An upper gastrointestinal bleeding is any gastrointestinal bleeding that originates proximal to the ligament of Schweitz. Imagine that your stomach is a stretchy bag that starts turning food into mush. After that, this mushy food then goes into a long tube called the small intestines. Now, the small intestine has three main sections. The first section is called the duodenum. The second part is called the jejunum, and the third part is called the ileum. Now, the ligament of Schweitz is like a tiny rope or a sling that holds up the spot where the duodenum ends and the rest of the small intestine begin. It is kind of like a support string that keeps everything in the right place. The ligament of Schweitz helps doctors to determine where the upper and the lower parts of the digestive system are. If there is a problem like a twist in your intestines, this ligament actually helps doctors to determine where exactly the twist might be. Now, some clinical presentations of an upper gastrointestinal bleeding include hematemesis or vomiting of blood, and also when the vomit looks like coffee grounds. On physical examination, vital signs may reveal obvious hypotension and tachycardia. Now, if the patient has cool, clammy skin, then that is an obvious sign of a shock. Abdominal examination of this patient might also disclose tenderness, masses, ascites, or organomegaly, which is actually an enlargement of the internal organs. It is always prudent to perform a rectal examination in order to detect the presence of blood and its appearance, whether the blood is bright red, maroon, or melanotic or dark. Now, other findings might include the presence of spider angiomas, palmar erythema, jaundice, and gynecomastia, which are suggestive of a liver disease. But if you start seeing stuff like pedicure and purpura, then that might suggest an underlying coagulopathy. Some differential diagnoses for an upper gastrointestinal bleed include peptic ulcer disease, upper gastrointestinal malignancy, esophageal or gastric varices, esophagitis, Mallory-Weiss-Ter, Boerhaave syndrome, and arteriovenous malformation. Now, some very important investigations that need to be done in order to establish a diagnosis include ABO grouping and cross-matching, complete blood count, hemoglobin level checking, blood urea nitrogen and creatinine, as well as electrolytes. Now, these electrolytes might include sodium, potassium, chloride, and calcium. It is also important to determine partial thromboplastin time and prothrombin time with international normalized ratio, as well as liver function tests, lactate levels, obtaining an electrocardiogram in patients with underlying coronary artery disease, as well as a bedside ultrasound. That might also help. Now, the non-pharmacological treatment in such a scenario might include maintaining the airway, the breathing, and the circulation, and also giving oxygen if needed. On the other hand, the pharmacological treatment include giving blood in the case of a severe pallor or ongoing bleeding, and also when the hemoglobin level is less than 7 grams per deciliter with active bleeding. Now, adult patients receive 2 units within 1 hour, and pediatric patients receive 20 milliliters per kilogram whole blood within 1 hour, or 10 milliliters per kilogram of packed red blood cell. Also recommended under certain circumstances include 0.9% sodium chloride intravenously or 2,000 milliliters compound sodium lactate intravenously for an adult. And in pediatric patients, you give 20 milliliters per kilogram. Now, you can also give 80 milligrams stat intravenously pantoprazole in adults, which is followed by an infusion of 8 milligrams per hour for 3 days. In pediatric patients, however, you give 1 milligram per kilogram stat and then an infusion of 1 milligram per kilogram per hour for 3 days. If the features are suggestive of a cirrhosis, then it is recommended to give 500 milligrams of intravenous ciprofloxacin 12 hourly for 7 days or 2 grams of intravenous ceftriaxone 24 hourly for 7 days. Kindly note that the recommendations and pharmacological treatment discussed are based on a particular jurisdiction and may vary depending on the setting. Thanks for watching.